Hello and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Good morning. Thank you for having us.
Good morning.
Okay, Minister. So it's our understanding that the task force under Operation COVID Curb plans to increase the enforcement of COVID-19 guidelines. Is this a welcome and timely initiative?
I think it is because most people have been complaining that we don't have as rigid enforcement as we should. And I think it's important that we reinforce these messages because unless we have a vaccine and we are able to immunize people, then people would have to take the preventative measures. I fully understand that it's almost going on to a year now that people were asked to use masks and to take all these different measures, and sometimes it can be fatiguing to take these measures, but we are doing so not because we want to inconvenience people, but because we want to protect people. And the more people that comply with these measures, the safer it's going to be for all of us because we'll be able to interrupt transmission. So I really hope that we can have the cooperation and collaboration of everyone so that these measures can be more effectively employed. And once we have them in place and they're working, we would see a reduction in the amount of cases that we're having.
Okay. Minister, at this point, can you say exactly what they plan to do to enforce this?
Well, I'm sure the joint services would be talking more about this, but really is to up the level of what they have been doing, going out, doing more frequent visits, and reaching out to those places that have been breaching the protocols and so forth. So these are the kinds of activities. And of course, we have written to a number of establishments that have violated the protocol, and we'll revisit this, and if they continue to do so, then other actions would be taken.
Okay, Minister. Now, turning our little attention to COVID-19 and the strain of it, I know you've recently said that Guyana does not have the capacity to test for the new strain of the virus, but there's a section of the media that has reported that persons have been tested positive for the new strain. How important it is for media houses to be more responsible in their reporting, particularly in light of the COVID situation?
It is important because I know people want to get information out there and to help, and we welcome that, but the information that we put out must be verified and checked and to make sure that it's accurate. And sometimes in our enthusiasm to get things out there, and if we don't fully understand the science and the background and so forth, how we convey that information can be misleading. And so I just want to urge people to be cautious. The variant that we are talking about that emanated from the UK, it's a variant that is called B.1.1.7, and that variant has at least 17 mutations that were detected on the virus itself. Of those 17 mutations, you have at least about 8 of them that are on the spike protein. And as you would recall, when this was first announced by Prime Minister Boris Johnson, he spoke about the increase in transmissibility of the virus. And if this is going to be a variant that is more transmittable, then it means that more people can get infected. We have not been able to detect this type of virus in Guyana because we just don't have the capacity to do it. For us to be able to differentiate between variants or mutations that are happening with this virus, it would mean that our laboratories must be able to do genetic analyses, and we don't have that. So none of the labs that we have here would have in-house capacity to do that. So people saying that we have been able to sequence the genome or look at the mutations that are occurring is just not correct. Now, There's no doubt that, like in other instances, when we do have samples and we want to do further analysis of these samples, that we can take those samples and send it to other reference labs. In our context, for samples that we would like to do genetic sequencing on, we have an arrangement with CARFA to be able to send those samples to CARFA. And in fact, CARFA recently started a project where they'll be doing some extra surveillance on various types of this virus. And they're asking the countries that collaborate with CARFA that if we have samples that we like to sequence, we should contact them. There's a protocol to follow, and we'll send those samples to CARFA for sequencing. So that arrangement is in place, and if we believe that there are samples that need to be sequenced, then we will do so. In with the private laboratories, maybe they too can collect samples if people are desirous of using them to find out about variants. We don't have in Guyana that capacity to do genetic sequencing. So these labs can collect perhaps the sample, and they would have to send it to a partner lab outside of Guyana to get this work done. So I want to be clear with people that while we do not have that in-house capacity, that does not mean that if we need to do the sequencing, that we cannot do it. And in this instance, we have a relationship with CARFA, and we have a pathway that whenever we need such sequencing to be done, that we can do it with the CARFA laboratories.
Okay, Minister, thank you for that. Coming off of COVID-19 for a little bit, you had mentioned recently that there will be some maternity homes constructed in several areas of the country. Can you say again where these will be established and what type of services will be offered?
Well, as part of the ministry's program to improve maternal health, we are looking at all our facilities across the country to see how we can improve the current infrastructure, make sure that we have adequate equipment at these hospitals and so forth, to ensure that we have safer services in terms of maternal health care. Of course, the services does not start when you come just for delivery of the baby. Starts way before then in terms of antenatal clinic, and then even after delivery to have follow-ups. So there's a continuum that we have to offer, and we still have challenges where mothers are not coming in the first trimester. So that's something that we keep working on, and we are hoping that we can get more mothers in that first trimester so that we can provide adequate service and advice and so forth to ensure that their pregnancy is not complicated. Now, having said that, we also recognize that we need to add some additional facilities, and we have a loan with the Inter-American Development Bank, and that loan is to help to improve maternal and child care. We have borrowed about $8 million US, and that money has been used to start doing some improvement. One component of that loan has to do with developing new infrastructure, and we have spent a large sum of money at LETEM to develop a waiting home there. That would have approximately about 18 beds, and we will have both for antenatal care and postnatal care. And of course, it comes with an area designated for theater space and so forth. That right now is under construction in LETEM, and we hope that by sometime in the first quarter of this year, that would be completed. In addition to that facility, we have examined the need for a similar facility on the East Coast, and we are right now concluding the arrangements with the Inter-American Development Bank on the location of the facility. And once all those things are settled, we will proceed this year to start the construction of that facility. That facility would be 12 beds, 6 for antenatal care and 6 for postnatal care. And it would also have diagnostic capabilities, labs, theaters, and so forth. So it would be a very comprehensive facility where all these services can be offered. In addition to that, from government resources, we have also finished a building in New Amsterdam. That building, we'll have to equip it, and once that is equipped, we'll have another home up in New Amsterdam. And as I said, we have been constantly evaluating and checking all the other regional hospitals to ensure that we have enough facilities there. So this is a work in progress, but immediately there are these 3 facilities that we are looking at. The one in Region 6, we have to add equipment so that we can make that functional. The one on the East Coast, we are now in the process of concluding the arrangement to start the build-out. And the one in Region 9, that is currently under construction.
Okay, Minister, in terms of staffing at these facilities, what would the capacity be like, as well as would the services come at a cost for patients?
No, none of this would come at any cost to the patient. The government would take the costs, as we have been doing in the public health system. And in terms of staffing, we have existing staff that can be utilized, but of course, as we add new facilities, we have been reviewing the staffing structure, so we'll have to recruit some more persons that would be in these specific facilities. But some of the existing staff can run the facilities when they're completed.
Okay. For clarity, Minister, I know you would have mentioned maternal care does not start after the baby is born. In the instance where a mother has complications, can she go to such a home and be there and be monitored?
Well, in many cases, if after delivery, if the mother has some complication, that's why we have the postpartum section where they can be monitored. So in these facilities, we have both for before pregnancy, we can take care of you during pregnancy and after the pregnancy, and that's how they're structured. And they have different sections that would be dealing with that.
Before we wrap up on this topic, how soon do you see the first project being completed?
The one in New Amsterdam has already been built. What we have to do now is to make sure that we get the equipment to be able to make that functional. And so that's something we have budgeted for these equipment in our this year's budget in 2021. So once we get those resources in the budget, we'll be able to fully equip that facility and then make it operational. The one at Lethem that is currently under construction, we have the resources for that, both for the construction and for the equipment of that particular facility. And we have already allocated the monies for the one in the East Coast.
Okay, Minister. Now, going back to COVID-19 and in relation to vaccines, has there been any further movement in the relation to the vaccine task force being constituted and its first meeting?
Tomorrow we'll be having the first meeting of the task force. So at that time, I guess you'll hear more about what we're doing and our plans and so forth.
Okay, and you can't say what might be on the agenda for tomorrow?
Well, the agenda basically, it's a basic introduction to all the members, and then we have a number of presentations that we'll be going through so that we can update the task force and where we are in terms of procuring vaccine, deployment of vaccine, and so forth. And then what would be our expectations of the task force?
Okay, Minister. Now, before we go, I must ask you, do we have any updates on the testing on dorm students?
We do, and we have been able to continue testing at all the dorm facilities. And currently we have, I think there are about 30-something persons who have been positive. This would include both students, teachers, and staff of these dorms. And that's something that we have been looking at. So we have currently 19 students that have been positive, 10 teachers and 8 staff that have tested positive. So all these persons have been identified. They were all isolated. We continue to do testing because not all of the students are out. And so as they come out, we're testing them. And then depending on the result, we take the actions.
Okay, and you wouldn't be able to give us a breakdown by region as to where these students are?
We have it, but it's a very detailed thing. I'm not sure that you want all those details.
Okay, thank you very much for your time today, Minister. This has been DPI's COVID-19 update. For more information, visit our website dpi.gov.gy or our social media platforms.